So my name is Johan. I'm a neuroradiologist. I'm working in Antwerp, Belgium and Sint-Niklaas, Belgium, and I mainly focus on spine imaging. And I have a disclosure, I'm part of the medical advisory board of SmartSoft, which is the developer of this software. It's a pleasure to introduce this software because this is something that will impact, it at least impacted my daily work as a radiologist, because it focuses on something which is very common, reporting and detecting pathology in lumbar spine imaging, especially MR imaging. So Columbo is an AI assistant that works on your axial and sagittal T2 weighted images mainly, and it tries to improve your workflow as a radiologist. It presents a time saving. We are at version 2 nowadays. It presents a time saving, and it depends of course on which radiologist you're looking at, but a time saving of around 50% in making your reports of lumbar spines. It has a fairly high accuracy in detecting pathology, over 90%, and it nowadays reports more than 20 lumbar spine pathology findings. It works by segmenting the spine, detecting the abnormalities and reporting them, and it makes an automatic report from the spine that is pre-populated with all of the pathologies and measurements that the software made, which can be used as a base for your final report. And that's available in different languages. For me, for instance, it's also available in Dutch. The most important thing I think about this software is that it brings consistency in the reports of lumbar spine among a large group of radiologists. I work in a group of almost 30 radiologists, and there is like a plethora of systems reporting these spine images. And the consistency, especially towards referring physicians, I think is very important. So it's consistent and it's a standardized form of report. It has FDA and CE and TGA approval, so we do use it every day. We can use it every day. And I give you some examples of the segmentation the software does. It detects, of course, the vertebral body and the vertebral disc, like in blue over here, the vertebral arch, so the bone, the facet joints, disc herniations, the dural sac, the nerve roots, like the exiting nerve roots, and it does measurements on these things. It will measure the area of the central spinal canal. It will measure the disc herniations. It will tell you of the disc herniation where it is located, like central, subarticular, foraminal. It will make a differentiation between, according to nomenclature, disc protrusions, disc extrusions, and again, it will report the size and location. And size is something most radiologists do not report, but it's interesting to know how large a disc herniation is. And also things like migration, upward, downward, are detected and reported by the system. More importantly, it also looks at nerve root impingement, so nerves that are impinged by a herniated disc, or as we will see in a few minutes, nerve roots that are impinged in the neuroforamen. It also measures dural sac compression, spinal stenosis, central spinal stenosis, foraminal spinal stenosis, and it will report all of these features in a finished report, which is available for you as a radiologist. Other features that are shown is spondylolisthesis, and for the FDA-approved version, also molding type changes, which I hope will come soon to the CE-approved version too. It will also do measurements like fractures of vertebral bodies, do the measurements in percentages and millimeters for you, so you don't have to do all of these measurements, for example, in osteoporotic fractures, where we need to report exactly how much millimeters a vertebral body height loss is. Now let's focus on this foraminal stenosis. For foraminal stenosis, it uses the same grading system as we used before, which is the system which was published by Lee. And it's a fairly simple grading system. And you know, grading systems only work when they are simple, easy to remember, so you don't have to refer to some kind of pancart of like some kind of table. It has a good correlation between raters and intra-raters, and preferably there is some connection to the symptoms of the patient. And there was recent a publication in 2024 about the correlation between foraminal stenosis and the greater foraminal stenosis and radicular pain. So there is a clear correlation between those. Now, Lee says like you have a normal foramen where you can see the exiting nerve root, and you know this is actually the dorsal root ganglion you see. There's fat tissue around it, and then in a stenosis, there is either mild stenosis, which means the fat tissue around the exiting nerve root is lost in two directions, either vertical, horizontal, or oblique. Moderate stenosis, where all the fat tissue around the nerve root is gone, and severe stenosis, where there is impingement or deformity of the exiting nerve root. I give you some examples of the software. It will annotate this on your images exactly as I show it here. It will annotate the neuroforamen, and it will annotate the exiting nerve root, and it will give a grade on that stenosis. For example, in this case, it will say it is narrow because it knows what to expect from a size, but there is no impingement of the nerve root. In this case, shown on the left and shown annotated on the right, it says there is lots of fat tissues in two opposing directions, considering this as a mild stenosis. When there is loss of fat tissues in more than two directions, it will consider it as a moderate stenosis. And finally, when there is impingement of an exiting nerve root, like here, where it can be hard to actually detect the exiting nerve root, it will actually classify this as severe. Of course, there will be some cases where also for radiologists, it can be very hard to make out what exactly is the exiting nerve root, what is disc herniation, and what is facet joint, or what is yellow ligament hypertrophy. And in those cases where the software is actually unsure which is the exiting nerve root, it will also file this, and it will say this is indistinguishable, but probably severe stenosis. Thank you for your attention. I think this is very promising, and I hope you will be considering using this software. Thank you.
Thank you very much. Are there any questions about this presentation? I have one question then. As you're also a practicing neuroradiologist, and I was wondering, using the software yourself and the team of radiologists, how does it really impact your daily work most?
Thank you. I think that's a very good question. So we are a large group of radiologists. This software, so it's available in the pack. So once you open up your lumbar spine exam, the annotated images will be there with the measurements, and also the report generated by the AI is available. For the radiologist, they can choose actually to use the report. You just like a trigger in our reporting system. When you say like automatic report, it will pop up, and then you can change whatever you want to change. I think the most impact is on residents and fellows, which are not used on reporting. It gives them some security or a good feeling that they have a pre-populated finished report which they can use as a basis, and they will save time because they know like most of the things that are actually important in the spine report will be there, so it makes them a little bit more confident. And for me, the most important thing is that in this large group of radiologists, and I don't know about your hospital, but everybody thinks they are specialists in reporting spines, and everybody can do it, but still there's a large, or there used to be a large inconsistency in reports, how it is reported, and this brings a little bit more consistency, which I think is very important towards the referring physicians.